Welcome, Dr. Lefty.
Thank you for watching my videos. Today I am going to discuss about the manifestations in an infant of a diabetic mother. So the pathway starts with maternal hyperglycemia. What happens is that the sugar will pass through the placenta from the mother to the fetus. So right now I'm drawing, this is the placenta, and sugar will pass from maternal blood to fetal blood. So what will happen in fetus? Hyperglycemia. Whenever there is lot of sugar inside the body, which hormone is elevated? Insulin, right? So the baby have hyperinsulinemia. So this is going to be the starting point for all the manifestations. Insulin is an anabolic hormone. So as a result of hyperglycemia, all the tissues in the baby will be bigger. So we call it big baby. In medical term, we call it macrosomia. So the next manifestation will be the big baby will have a big heart. Not the entire heart is big. Suppose this is the heart. This is left atrium, this is left ventricle. So this particular part of the heart is big, which we call interventricular septum. However, the entire septum is not appearing bulky. The upper part is less bulky and the lower part is more bulky. So we call it asymmetrical septal hypertrophy. Now after this, come here. So here we can see that the big baby will have bigger tissues and they will require a lot of oxygen to function. So the specialty of fetal hemoglobin is that it does not readily release oxygen to tissue. So to compensate for this, the baby will produce more and more RBC. The medical term we call it polycythemia, because the tissues are bigger, so they need more oxygen, but the supply of oxygen is less because of fetal hemoglobin. So whenever there is lots of hemoglobin in blood, there will be lots of breakdown, which will cause jaundice in baby. Another complication of polycythemia is whenever there is high blood cells in the circulation, there will be high turbulence, which will cause more coagulation, which will result the next complication, thrombosis. Now going back, there is hyperinsulinemia, so high insulin. So this high insulin will interfere with the surfactant function. Although baby have a lot of surfactant, this insulin will interfere with the surfactant function. As a result of this, the baby will have another complication known as respiratory distress syndrome, though the baby does not have any surfactant deficiency. Now the most important part, fetal hyperglycemia. In the body, excessive sugar inside the fetal body or anywhere is supposed to be teratogen. What does this mean is that excessive sugar in the body can cause embryonic abnormalities or congenital malformations. So this can be very bad for the baby development. The congenital anomalies, they depend on the mother type of diabetes mellitus? Is it gestational or it is preterm? Gestational diabetes mellitus, I am writing here GDM. It starts during the second trimester, 24 to 26 weeks of gestation. So by the time all the fetal organs would have formed. So if the baby is predisposed to this excessive glucose, it will not result in any congenital anomalies. So here I am going to write cross because the baby will not get any congenital anomalies. Now, if the mother is pre-diabetic or over-diabetic, then the baby will acquire these congenital anomalies, right, during the first trimester. That means the mother was diabetic before the pregnancy, that is pre-diabetic with uncontrolled diabetes mellitus. The most common congenital anomaly is VSD, vascular septal defect, and the most specific congenital anomalies is caudal regression syndrome. So this is the most important topic, these two common and specific congenital anomalies. Now after that, the baby is born, so the placenta will be cut off. In the baby after the delivery, the placenta will be cut off, so the supply of oxygen that the baby is getting from the mother will be abruptly stopped. Now in the baby, there is low glucose and high insulin level. So what will it cause? There is decreased glucose in the baby and there is high level of insulin. So this will cause the most important complication, hypoglycemia and hypocalcemia. The reason for hypocalcemia is that there is maternal fetal magnesium loss. During the pregnancy, the diabetic mother urinates a lot of magnesium, causing the deficiency in them and the fetus. And this causes the postnatal calcium suppression. This suppression happens because low fetal magnesium impairs the parathyroid gland. This blunts the baby's ability to produce parathyroid hormone. So after the placenta is cut off, the baby's supply of calcium is also cut off, causing the abrupt hypocalcemia in the baby. What are all the complications that I have discussed for an infant of diabetic mother? Number 1, big baby. Second complication is asymmetric septal hypertrophy. Third, polycythemia. Fourth, jaundice. Fifth, thrombosis. Sixth, respiratory distress syndrome. Seventh, congenital anomalies. And eighth, hypoglycemia and hypocalcemia. So I hope you understand everything and you like the video. If you like the video, please subscribe to my channel and please tell me any topic you want to learn again. I will make a video for that also. Thank you.